Welcome to Health Source of Toledo, Ohio. Today's topic, understanding the concept of non-surgical spinal decompression. After the diagnosis comes the challenge of understanding the suggested procedure. The look on his face after he was told that non-surgical spinal decompression would be a good option said it all. His look said, "This is hopeless. How can this possibly work? I don't understand a single thing about the technique." Understanding the terms of your pain. A herniated disc, bulging disc, pinched nerve, or sciatica are all related to the way a disc is operating in relation to the vertebrae that it sits between. In normal everyday function, we don't pay much attention to these small discs that rest inside of our spine. Their roles seem small and insignificant until we are no longer able to walk, bend, or stand without pain. The only thing that really separates one vertebra from the other is the presence of a small disc. So having the pressure of a disc pushing out from in between two vertebrae or being compressed by two vertebrae is the creation of very painful feelings. Where does it hurt? When the back pain is predominantly in the lower back and even traveling down to the legs, it could be the result of a disc malfunction in the lumbar region of your body. Quite often the herniated disc is in the lumbar area of the spine. Remember that this discomfort is usually the result of a process that's been going on over a long period of time. For many, just the act of getting older can bring on this condition. Around the years in our late 30s, our discs are still in a gel-like form. Then for some, the discs begin the process of drying out. It's during this drying out phase that we become susceptible to disc herniation. Experiencing pain time and time again. Facing the option of decompression more than likely came about because the pain in your back has become truly overpowering. There's no limit or exact timeline for how long the pain will subside without a form of correction to the problem. Pain medication is often used to relieve the symptoms, which is why in the long run they grow ineffective, because the condition still hasn't been addressed. Deciding on which way to handle your herniated disc is best discovered when both the patient and doctor can talk it out. Chiropractic doctors are perhaps some of the best doctors to speak with regarding this situation. The purpose of these physicians is to make sure that the problem is resolved, not just for a day or a week, but for life. So they will have no problem with discussing your options in depth. One of the major reasons non-surgical spinal decompression is chosen is because it's effective and non-invasive. Most patients that go through the unique progressive procedure have an 80% chance of not having back pain again. Although all the pictures on the brochures and long terminology may make non-surgical spinal decompression seem complicated, it's really a simple way of working with the spine so that your discs are sitting comfortably again. To find out more information on topics like this, please go to www.healthsourceoftoledosouthwest.com.